All right, ladies and gentlemen, boys and girls, welcome to Disability 128 podcast. I'm your host, Sean Ferguson, and for today's message is I'm going to show you this video of Emily's story. She has uh, Chiari Malformation. It's a disease, or I should say, some type of disease where her brain like falls backward down to her skull, and it causes her to get headaches and and dizziness, and things like that. It caused her to have like back pain and all sorts of things. So, but before I send you this video, please subscribe to my channel, click the notification, click the like button. I would really appreciate it. Also, you show this videos to your friends and family that is in the special needs community, because they all need to see this wonderful, beautiful story. And just tell me what you guys think about this video.
Condition causing my brain to fall out the back of my skull. My brain went all the way down. It takes me hours to get out of bed every day because of the pain. Other days I can't get out at all. Hi! I have unfortunately lost quite a few friends. People have accused me of faking the condition, but I've got the scar to prove it's real. Surgeons performed decompression surgery, but it didn't help for long as all the symptoms came back. It's all slipped back down and there's barely any fluid around my brain again. I'm waiting on a pioneering new surgery to prevent my brain from slipping any further down. Hopefully it will give me a new chance at life.
Morning. You okay?
Yeah. Thank you.
How you feeling?
Sore, but I'm alright. Chiari Malformation is a brain condition. My cerebellum, which is the back part of my brain, is slowly slipping down into my spinal canal through the opening in the base of the skull. I eat my breakfast lying down because I'm in so much pain in the mornings that I can't sit up. I slowly have to bring myself up on the bed, so I have to eat like this, but it can get quite uncomfortable. A really bad day, I will not get up whatsoever. I'll be laid down the entire day. It mainly hurts at the back of my head, but my entire body usually hurts.
Every day you walk through the door and it's just emotional. I'm sorry. You walk through with anticipation that it's going to be a good day. Talk to her 2 minutes and you know it's not going to be like that. It's not going to be a day like that.
The headaches started when I was 7. I didn't think anything of them as they were barely anything. I was skiing when I was 14 and I felt really poorly that skiing holiday.
Yeah, you did, didn't you? We didn't really notice much signs, did we, when you was young?
When I was 14, the pain became consistent. I just felt more and more pain in the back of my head, my neck, my shoulders, down my spine. I was getting weird tingling sensations in my arms and legs.
She went from being a kid that does everything, skis, runs, loved dancing, to lying in bed 90% of the day. It was quite shocking. We took her to A&E 3 times, and on the 3rd time, Emily was just in so much pain. They didn't know what to do to help her.
I was finally diagnosed in October 2021 when I was 15 after an MRI scan, which me and my dad had to fight for. They kept saying to me, come back when it's worse. And my dad just said, it can't get any worse. She's bedbound, she can't do anything. He wouldn't leave until they looked into it more.
It was a big relief when we got diagnosed because we knew, didn't we? We had something, the reason why she was getting all these headaches, and we had all these question marks before.
At first I didn't understand the scans very well. When I did start to understand, I noticed how severe the Chiari was. I did realise that my brain was herniating quite a lot. This was my first ever MRI, and my brain went all the way down. And you can see the white bit around my brain, it's grey, there's like barely any of it. But then on this, after the decompression, how much more of that
Comparison is amazing, isn't it?
I had decompression brain and spinal surgery 3 months after being diagnosed. They remove a bit of my skull, a bit of my spine, remove a bit of my herniating brain, and replace the brain lining with a skin graft from inside my head to expand it. It allowed fluid to flow around my brain, relieving the pain in my head, my neck pain, my back pain. However, a lot of that has come back since. My more recent one here, it's all slipped back down and there's barely any fluid around my brain again. This is my brainstem. I believe that goes down into the filum.
And that's the bit they're going to cut.
They're going to cut, yeah. Right. I'm hoping to have the filum terminal sectioning surgery in 3 or 4 weeks' time. I have to go to Barcelona for this surgery as it's not done in England and not performed under the NHS. I am having to pay a lot out of my savings, which is quite upsetting as those could be used for my future. But I'm happy to spend them on this as hopefully this will give me my future. I play a lot of netball a week. I would do training 2 times a week, sometimes 3. When I was 17, roughly a year after my surgery, I just couldn't handle the symptoms that were coming back anymore, so I had to stop. I'm hopeful about the surgery. Hopefully it will give me a new chance at life. I'm more nervous of the fact if it doesn't work and if it doesn't help me, as it seems to be my last chance to actually help the condition. Hiya, how are you?
I'm good. How are you doing, Emily? How are you feeling? Are you getting any worse or how are your symptoms?
I'm struggling at the moment. It has been a lot worse the past few weeks. I first met Margot on a Facebook group where people talk about their Chiari, and people who have had this filum surgery or are hoping to get the filum surgery talk on there. And she is a big advocate for the filum surgery.
So they go in and they make a 1-inch incision at the base of your spine and they clip the ligament and it releases the tension on the spine. Many people get their neurological symptoms, reduced. In my daughter Caroline, hers was like a tight rubber band. We had to get her handicap pass because she could barely walk. And 4 days after surgery, she was walking up a flight of stairs, not even holding on to the handrail. My other daughter's headaches were gone. She also had swallowing issues where she felt like she had something stuck in her throat. That sensation was completely gone. Very miraculous for my kids.
That is incredible. Gives me a lot of hope hearing that.
Think of a positive outcome, think of my kids, and hopefully that will be the case for you as well.
Yeah.
And you're definitely in good hands.
Thank you so much for talking to me about this.
I wish you the best of luck. Please keep me posted.
Will do. Thank you.
Okay.
Bye.
Bye-bye.
Hi.
How are you?
I'm good. How are you?
Good.
When Em's having a bad day and I'm coming over, normally she'll be up here. I'll just walk in her house. I'll come upstairs and I'll just sit here with her. It's just really nice to know that we can do that.
Over time, I have unfortunately lost quite a few friends. People have accused me of faking the condition. A lot of my friends, unfortunately, didn't believe me. I know that my condition's real, I know that I struggle with it, and I don't blame those who do think that, as they don't experience it, so they don't know. But I just hope through me spreading the awareness that more people understand, are not as naive about chronic illness. I decided to make a TikTok account about my condition and try and spread awareness. I've had many good reactions, positive reactions, and a lot of people come back to me telling me that I've helped them, which is crazy. That's an amazing feeling. That's what I want.
Bringing the Chiari situation to the forefront of as many people's lives as you can is going great. So I'm super proud in that sense, super proud.
I just want Emily to get back to normal, be able to do the fun things, be a typical 18-year-old instead of lay down all the time. Yeah, good to see her having fun again.
I do hope that me talking about the illness and my struggles helps other people talk about those and also just understand more and know they're not alone. I'm now 4 days post-surgery and I thought I'd give a little bit of an update. I woke up after the surgery and I had immediate relief. I didn't have any pain in my head. Previously, I couldn't sneeze or cough without being in absolute agony. I have sneezed and coughed since the surgery and with little to no pain in my head, which is absolutely crazy.
All right, what an incredible story. And I will say I'm happy that she got that surgery and she feels so much better, and that she doesn't have any um, issues with pain and headaches and things like that. So I'm really grateful that they had that surgery, and people who does have Chiari malformation now has the resources to help, to help cure people who has, that type of condition or has that type of a disease. All right, so what is Chiari malformation? Well, I'm going to tell you, because I've been doing my research. So basically, a cherry a Chiari malformation is a problem in which a part of the brain, which is the cerebellum, at the back of the skull bulges through a normal opening in the skull where it joins the spinal canal. This puts pressure on parts of the brain and spinal cord and can cause mild to severe symptoms. In most cases, the problem is the present at birth. Um, there are several types of Chiari malformation, but type 1 is the most common. In type 1, the cerebellum bulges through the normal opening at the base of the skull. This type is most often congenital, or I think it's called congenital. It is also called primary Chiari malfunction type 1, but it is often not found until a person is a teen or young adult. In rare cases, this type may also develop later in life. This is known as acquired or secondary Chiari malformation type 1. So, what causes a Chiari malformation type 1? The exact cause of a congenital Chiari malformation type 1 is not known. A problem during fetal growth may cause the defect. It may be caused by contact with harmful substances during pregnancy. Basically, like someone who's like doing some type of like drugs or things like that, it can cause that. I don't know if her mom like took medication while she was pregnant or what, but I mean that could cause it. Um, so or it may be linked with genetic problems that runs in the families. An acquired Chiari malformation type 1 happens to a person after birth. It is caused by excess leaking of spinal fluid from the lower back or chest areas of the spine. This can happen because of injury, contact with harmful substance, or an infection. Um, and things like that. Let me go back. Yeah, I'm actually doing my little research. I'm going to tell you more about it. All right. Chiari 2, more complex than Chiari 1, with the brainstem and cerebellar tonsils extending into the spinal canal, is often associated with a neural tube defect called I think it's melamingal or something like that. It's This terminology is really difficult. So I'm just doing the best I can to pronounce these words to you. But I think it's spelled mylomeningocele or my meningocele, um, and so on and so forth. Um, so Cherry 3, there's at least four different types of Cherry malformation. So Cherry 3 is a very serious condition where the hindbrain, cerebellum, and or brainstem uh, herniates through a defect in the back of the head or neck. And then Sherry 4, a rare type involving incomplete development of the cerebellum. The symptoms vary depending on the type and severity, and some individuals with Sherry 1 may have no symptoms at all. Common symptoms can include headaches, especially at the back of the head, worsens by coughing, straining, or bending, neck pain, dizziness and balance problems, numbness or tingling in the arms or legs, muscle weakness, vision problems, difficulty swallowing, ringing in the ears, and cognitive changes. Um, the diagnosis, well, basically, diagnosis and treatment, medical history, physical and examination, and imaging tests like MRI are used to diagnose Sherry malfunction. Treatment depends on the type and severity. Surgery is often required for Sherry's 2 and 3. For Sherry's 1, some individuals may only need monitoring, while others may benefit from medication or surgeries to relieve pressure. And basically, she has surgery. She had what is called filum filum terminal sectioning surgery. So she has that, and I will tell you what that is. So just give me a moment. I'm going to do my little research on there so that I can read this to you guys. So real quick, so give me a moment. I know I'm, kind of recording myself, but all right. So, what is filum terminal sectional surgery? All right. So I'm going to read this to you guys. Filum terminal sectional surgery, also known as filum terminal untethering or sectioning, is a surgical procedures to release the spinal cord from abnormal tension or tethering caused by a thickened or fatty filum terminal. This surgery is performed to prevent or alleviate neurological symptoms associated with tethered cord syndrome. So I'll read you what tethered cord syndrome is. Tethered cord syndrome is a neurological condition where the spinal cord is abnormally attached to surrounding tissue, restriction its movement. This restriction can cause a range of symptoms, including bowel and bladder control, issues, leg pain, and weakness and changes in gait. While often present at birth, TCS can also develop later in life due to scar tissue, tumors, or trauma. So basically, she has to get those surgery so that uh, the pressure that she's been feeling in the back of her head can be more relieved, and of course have fluid back there, I think. So, um, so basically, that's what it means. So, what is the filum terminal? The filum terminal is a thin fibrous strand of tissue that extends from the cornus medullaris, the tapered end of the spinal cord, down to the uh, coccyx, which is the tailbone. It helps to anchor and stabilize the spinal cord. What is tethering cord syndrome? Or I should say tethering cord. A tethering cord occurs when the spinal cord is abnormally attached or tether restricting its normal movement and potentially leading to nerve damage. So basically, like her brain in the back of her head is like causing like a lot of pressure into her spinal cord down to her tailbone. That's why she has a hard time getting up and getting off the bed, and so on and so forth. So like it's just, I would say it's like really painful. I'm just happy that she got that surgery done and now she's feeling much better, since she has that disease. So there is a cure for that type of, a disease. Um, what causes cord syndrome? Well, one cause is a thickened or fatty filament terminal which can pull on the spinal cord and limit its movement. So basically, when our brain like falls back, it kind of pulls on our spinal cord like down, and it's like it's putting strain on her neck and her back and gives her real bad headaches. So, you know, and this is a type of surgery that will help her. How is it treated? Sectioning the filum terminal is the primary surgical treatment for tether cord syndrome caused by a thickened or a fatty filum. What does the surgery involve? The surgery typically involves making a small incision in the lower back, opening the dura mater, which is the outer covering of the spinal cord, identifying the filum terminal, and then carefully cutting it to release the tension on the spinal cord. And basically that's what um, her surgery does, is it just releases the tension and now she doesn't feel pain anymore. So however, I think she still deals with her brain falling backwards, but this helps prevent um, the strain on her spinal cord. So, uh, why is it done? Well, it's pretty simple. The goal of the surgery is to prevent further neurological damage, relieve symptoms like leg weakness, pain, and bladder dysfunction, and improve overall neurological function. When is it performed? Filum terminal section is often performed on children, especially those with spinal bifida or other neural tube defects, but it can also be done in adults too. What are the potential benefits? Well, this is a good key. This is a good one. Studies have shown that filament terminal sectioning can lead to improvement in symptoms, a decrease in the size of associated syringe, I think it's syringomelia, a cyst, which is a cyst in the spinal cord, and prevention of further neurological deterioration. So, in her case, it just helps relieve pain in the back of her head, and prevents any further damage to her spinal cord. So that's a great benefits for her. What are the risks? So this is very important if you guys decide to do this. If you have this type of like condition or disease. While generally considered safe, like any surgery, filum terminal sectioning carries risks such as bleeding, infection, spinal cord injury, and spinal fluid leakage. There is also a risk of retethering of the spinal cord where the filum terminal reattaches and causes symptoms to return. So that's the risk of having this type of surgery. And from this video, as you can see towards the end, you guys saw that she was feeling better, she was walking, she was moving, she was didn't have any pain, she was doing great. And I would say, praise God that they have a doctor, a surgical doctor that can help her get back to health, that can help her, relieve the pain, and thank God that she was feeling much better, and she's very, very blessed that God created a doctor for her to help her heal. And it takes a miracle. I mean, that I would say that is a miracle from God right there. So just want to say thank you for watching this video, and I will see you on the next one. Take care, give care, and I'll see you later.